Okay. Dear Doctor, Dr. Anashina, you please kindly let us know the typical disease and cause of hip problem.
Hip problems are common in all age groups. You can divide them into hip problems in children, hip problems in the middle age, and hip problems in the elderly population. Usually the hip problems in children are things like Perthes disease, something called SCIFI, and most of these can be treated without any surgery, and they will recover on their own. The diagnosis has to be made, and after which the treatment can be instituted. Hip problems in the middle age, 20 to 40, usually encompass 2 or 3 conditions. One is called avascular necrosis. Another one is called ankylosing spondylitis. Avascular necrosis is a problem in which the blood supply to the hip is decreased, and therefore the bone gets damaged. The other one is ankylosing spondylitis. This is a genetic disease which affects mainly males, in which the hip becomes fused, it becomes very stiff, and the male and the patient is unable to walk or do his daily chores. So these are the conditions in which you see in the 20 to 40 to 45 age group. In the older age group, there are other conditions like falls. After you fall, you get a neck or femur fracture or an intertrochanteric fracture. You can also get wear and tear of the hip joint, which is called osteoarthritis. All these conditions in the middle age and elderly are most often treated with surgery. And the main surgery that we do is total hip replacement, in which we remove the joint and we put in metal and plastic to represent the joint. After the surgery, the patient is much improved in terms of pain and function.
Okay. Could you share with us the method of hip treatment and surgery which currently being applied in Raffle Hospital?
The surgeries that we do, as I mentioned, is mainly for hip replacements. We do something called a bipolar also, which is partial hip replacement. But for the conditions I mentioned to you, it's total hip replacement. It's a very successful surgery, and it's quite commonly done in Raffles and many hospitals in Singapore.
Benefit and side effect of the treatment and surgery methods.
So, as I mentioned before, the patient's quality of life is improved because now that you've taken away the diseased joint and given the patient a better movement and also no pain, the patient finds that he's able to go back to activities such as walking, going on holidays, and even doing exercises such as jogging, such as doing other things like cycling, and some of them have even tried to go to climb mountains. So hip fractures are hip replacement surgeries are considered to be a major step forward in orthopedic management. Of course, there's also side effects to this surgery, as any surgery, and one of the main side effects is infection. Because you have to cut the skin, and because there can be bacteria that go into the joint, infection is a possibility. Of course, we will take all the steps necessary to prevent infection, like cleanliness and sterility. The other thing about hip surgery, total hip surgery, is the patient can get dislocation. If the patient bends too much, the hip joint can come out. So we will tell the patient and give him precautions not to squat after hip surgery, and perhaps not to cross his legs. So these are 2 things that are main complications after hip surgery. But by and large, it's a very safe procedure. The complication to the side effects is very low. It's about 0.2%. So 99.8% of the patients are successful in the hip surgery. The patient is normally stays in hospital for 4 or 5 days. The first day after surgery, we have the patient to stand up. The second day after surgery, we get the patient to walk with a walking frame. And by the 4th or 5th day, the patient is able to walk with just a walking stick. And that's when we discharge them.
Okay. As far as surgery method of hip replacement,
Yes.
which has been applied successfully all over the world.
Yes.
It was called minimally invasive hip surgery.
Yes.
With computer. Has this method been applied in Raffle Hospital? Could you share with us what are advantages of this surgery method?
Okay. As you know, most techniques or most surgeries, we're always advancing. There's always a new method. People are always inventing better ways to do the surgery. And one of those, these better ways of surgery is called the minimally invasive surgery. For the hip, it can even be done for the knee with the computer. So how does the computer help? One, the computer helps to place or align the implants, the metal implants, in the optimal position using certain detectors and so on and so forth on the screen. So this will give probably a more optimal outcome for the surgery. The second thing is to do minimally invasive, meaning the cuts in the skin, the incision is smaller, sometimes 8 millimeters. And therefore the patient may have less pain after surgery because you do less dissection. These are good. These are good, and these are good for the majority of surgeons. But I think the most important thing is the surgeon himself, not the equipment or the instrument he uses. The equipment and instrument he uses is just as good as a surgeon. So if the surgeon is not so experienced, doesn't have so much of knowledge, you cannot make the equipment to make him better. So I think the most important thing is to use all these extra minimally invasive or even to use equipment, computers, to try to make the surgery better, but the surgeon has to be a good surgeon to be able to do that. A lot of the older surgeons or more experienced surgeons, they do not use computers or they do not use minimally invasive because they've been doing this surgery for so many years and they have very good results and very good outcomes. So they would like to continue to do it their own way, even if the incision is still small for them. And placing of the implants, yes, the computer can help, but the surgeon has experience, he's just as good as the computer.
Okay.
As I mentioned before, after hip surgery, the downtime or the hospital stay is very, very, very short. We get them walking and ambulating within the 3 to 4 days, and they go home by 4 to 5 days. The complications are infection and dislocation. So these are precautions that we tell the patient to take into consideration. Usually we see the patient, once the patient is discharged, we see them about 2 weeks, we see them at 1 month, 3 months and 6 months. This is basically to look at the wound, to see look at the healing, do x-rays to make sure the implants have not moved, and to look at their rehabilitation, to make sure that they get back to its original activities as after the surgery so that they can enjoy a better quality of life.
Similarly, like hip disease, can you let us know the typical disease and cause of knee problems?
Yes. So the knee joint is just below the hip joint. It also uses weight. When you walk, it is a lot of weight going through the knee. So knee problems can also be divided into the younger age group and the older age group. The younger age group is normally due to sports injuries. These injuries can be ligament tears, ACL, very common in footballers, and also accidents. They can get injuries of the PCL, which is another strong ligament, and other ligaments across the knee. They can also get injuries with the cartilage, the covering of the knee joint, and they can have an injury to the cartilage, and that can also be causing pain and swelling. And the last is the meniscus. The meniscus is a shock absorber. It acts as a shock absorber in the knee, and those can tear. All this can happen in sports and athletes who do a twisting motion to the knee, and usually we treat these after doing x-rays and MRI scans with surgery because these are active people and sometimes they need these ligaments for them to run or to play their sports. In older people, knee injuries or knee degeneration is osteoarthritis. So these patients get wear and tear of the cartilage because of the malalignment of the knee, and then they have pain, swelling, and deformity. They either go into a deformity of bow leg or the legs go the other way. Other diseases that cause injury to the cartilage in older and young age group is rheumatoid arthritis and also infection. So these can also cause cartilage damage.
He let us know the method of treatment and surgery that currently being applied at Raffle Hospital.
So as all diseases, we have to make the diagnosis. So we see the patient, we take a history, and we do a physical examination. This will give us 80% of the information needed for a diagnosis. We may do an X-ray to look at the anatomy, the bones, and we even do an MRI scan if we think there's a ligament or meniscus tear. After having done all these, we make a diagnosis and we determine what is the proper treatment, whether it's to do give medication, do physiotherapy, or do surgery.
Benefit and side effect of nutrition and surgery method.
Sorry?
Okay. Benefit and side effects of nutrition and surgery method.
Okay,
for knee treatment, for knee disease.
Sure. So as usual in all diseases of the body, we always try to treat them with medication and physiotherapy. But in certain conditions, there's a limit to how much we can treat the disease with these methods. And we usually look at the condition for 2 to 3 months. We see the patient again, and if we find that this is not successful, then we offer them surgery. It also depends on the patient. If the patient is a young person who's very athletic, who may be even in the national team, we have to be a bit more aggressive because they want to go back to doing their sport and winning the medals. So we may offer them surgery earlier than, for example, a patient who's a banker, who sits down most of the day, who doesn't do much sports. So for the same condition, we may treat them differently depending on the activity level and their expectations. But of course, in the older age group, if the knee is badly damaged, if the patient cannot walk a few steps because of pain, then we will always offer them surgery first, because I don't think medication will help in this situation.
Say a new surgery method of knee replacement can apply successfully over the world. We call minimally invasive knee surgery.
Yes.
As a computer, as the method has been applied in one hospital, could you share with us on what are the advantages of surgery method?
So minimally invasive surgery is to do surgery with the smallest incision, and sometimes to use a computer to align the implants in the knee. As I said before, every surgery or every technique in orthopedics or other aspects of medicine, they're always coming out more advanced techniques, more painless, less painless, and getting the patient back to his feet and getting back to activity. As I said, the surgery is very dependent on the surgeon. If the surgeon is skillful and the surgeon can perform the operation with a lot of experience, we may not need the need for using computers or minimally invasive. I think those are more important than having all these equipment. However, if you do have this computer-aided and minimally invasive surgery, there's a plus point. But I don't think it's such a great advantage as to have, say, compared an experienced surgeon doing the surgery.
Can you share with us advice for patients after knee treatment or surgery?
It all depends on the type of treatment and the type of surgery. The majority of the injuries in the knee can be treated without surgery. Again, as I repeated before, it depends on the patient. If the patient's expectations are going back to sports and being active, then we must be more aggressive and offer them surgery. There are many surgeries that can be done for the knee. The simplest one is to do an arthroscopy. That's a keyhole surgery. Is to put a camera, a scope inside, and with this arthroscopic surgery, many techniques can be performed in the knee. Ligament reconstructions, meniscus tears can be repaired, cartilage defects or cartilage damage can be repaired. So this is mainly sports related, and arthroscopic surgery is the main surgery that we do for these. The other surgery that we do is knee replacement. These are for older patients who have wear and tear the knee joint and the cartilage. This is a bigger surgery. It involves an incision of 8 to 10 centimeters, and the knee is opened up. The diseased portion of the knee is removed, and then you put in metal implants and plastic to get the knee function back to the original. Usually total knee replacement, as it's called, lasts for 20 to 25 years, and it brings the patient relief of pain. It straightens their knee, realigns their knee, and it gives them a greater activity level, almost back to its pre-disease level. So the patients are very happy. The downtime, or say the hospital admission for these kind of surgeries, again about 4 to 5 days. The patient is able to ambulate or walk on the second day with the help of a walking frame. And for knee surgery, usually we have the assistance of walking frame for about 2 to 3 weeks, after which the patient can walk without a walking frame. And by 2 to 3 months, they will have the normal distance they can walk and before the disease level. And sometimes they go for holidays and they do exercises and sports.
Okay. Could you please let us know what's the typical popular typical traumas in gyms and sports? Yes.
So usually the injuries that you find in gyms and sports are related to the younger population, because they're the ones who do most of the sports in gym. However, nowadays we find people who are older who are also joining sports, even up to 60, 70 years old. So usually the common injuries are the soft tissue injuries that we have. Things like ligament tears, ligament injuries, cartilage injuries, and meniscus injuries. For the shoulders, we have some muscles around the shoulder, and the tendons can be torn, partially torn. We can have dislocations of the shoulders. For the hips and the knees, we can have cartilage damage, we can have meniscus injuries. So it really depends on what type of sports you do. If it's more upper body, upper limb, then you get shoulder injuries. If it's more like running and jumping, then you get hip and knee problems. You can also get back injuries for sports in which you do a lot of bending, a lot of jumping, and a lot of weight carrying. So those can also cause injuries to the back. And of course, the last one is because you use your muscles, you can tear your muscles. So these are some of the injuries you can have in people who do a lot of gym, or people who do gym once in a while. Those who do gym frequently and who have a trainer get less injuries because they are aware of the type of injuries they can get. They take precautions. It's those people who do gym maybe once a week on the weekend, and then they try to go maximize their gym performance. Those are the ones they usually get injuries and tears. So they have to be careful. Those who don't do gyms frequently, who don't have a trainer, they have to gradually increase the pace of their activity when they're in the gym.
I heard that you reconducted for many athletes who got complete tears of recruciform ligaments, shoulder ligaments. Could you please share with us your experience in these related reconductions and your advice for the concerned athletes after reconstruction?
Okay, so I think you're talking about cruciate ligaments. The cruciate ligaments are in the knee. There's 2 ligaments. It's the anterior cruciate ligament and the posterior cruciate ligament. Usually it's the anterior cruciate ligament that is torn. And many times it's in the footballers. When they do kicking the ball or they pivot, they hear a pop sound and then they get knee pain with swelling. This is quite typical of a cruciate ligament, anterior cruciate ligament tear. There's also something called a posterior cruciate ligament in the knee. This is normally injured during road traffic accidents or motor vehicle accidents, in which there's a collision and the knee hits the dashboard, and then you get the posterior cruciate ligament, which is not so common. So the anterior cruciate ligament is very commonly injured in knee footballers mainly, and because they want to continue playing the sport, they have to have something done. You can treat them without surgery, but the knee will never be as strong as it was before. They'll always be a bit weaker, especially when they turn, which is called pivoting. So we recommend that if you're active, if you want to go back to football and you want to play actively, you have to get a reconstruction or a surgery to make a new anterior cruciate ligament using your own ligaments. It's called an autograft. It's a very common surgery. It's not very serious. The patient stays for about 1 night after the surgery and goes back home. Physiotherapy is very important after the surgery for at least 3 months to get back the muscle strength, and they can go back to playing football at 4 to 5 months after the surgery. Very successful, very commonly done, and I recommend those for active people. The posterior cruciate is not as commonly torn, but if it is torn and you're active, it should be reconstructed. The other ligaments that can be torn is in your shoulder. There are something called rotator cuff muscles in your shoulder, and they help you to raise your arm. These are also commonly torn, and the most common one is called the supraspinatus. This can be torn in younger athletes, but more common in middle-aged, 40, 45, and older patients who have a fall. So these can cause shoulder pain. It can give you loss of function of the shoulder in terms of movement going behind your head, and can lead to frozen shoulder, which is a stiffening of the shoulder. So if the tendon is not completely torn, partially torn, you can treat them with physiotherapy, heat therapy, a range of motion, medication, sometimes injections. And if the patient is not active, this is enough. But if the patient is active and causing a lot of pain, then I recommend surgery, which is a keyhole surgery, arthroscopic surgery, to try to clean up the tendon and sometimes even to repair. So these are the most common injuries to the shoulder. Sometimes you can also get dislocations of the shoulder. Usually in a younger patient, if you get a dislocation, it will keep coming out. Recurrent dislocation, we call it. In older patients, that's not the problem, but that is associated with the rotator cuff tear. So in younger patients, when you have recurrent dislocations, it's very difficult for them to perform overhead activities. So that is because there's a tear in the stabilizer in the shoulder, and we have to repair the tear to keep the shoulder stable. So that is called a Bankart lesion, and the surgery to repair that is with the arthroscopic keyhole surgery, and it's very successful.
Thank you very much.
Thank you.